I'm so glad you all could make it. I'm just going to give you a few more minutes to see who else is going to log in and give you a chance to go get yourself a cup of tea, put on your fuzzy slippers, get comfortable. So we'll give it a couple more minutes and then I'm going to get started. I'm Dr. Alexis Gopal, and I just want to let you guys know that my moderator today is Julia. She's our health coordinator, and she's going to be available at the back end in the chat box if you have any issues, if you can't hear me, if you have any questions. Just an FYI. So we're just going to give it a couple more minutes, and just to keep things on schedule, I am going to get started, even though not everyone is signed in. So just a couple more minutes, and then I'm going to get started. Can everyone hear me? Can you type in the chat box if you can hear me? Just want to make sure the sound is working okay. Awesome. Awesome. Thank you. Awesome. Thank you so much. Thanks for letting me know. Hi, Isabel. Hi, Jean. Hi, Barbara. Hi, Serene. Hi, Petros. Hi, Gary. Okay, I'm glad it's sound is working. Let's see. It's 7:02. I'd like to keep the webinar on schedule because I know you're all busy and it's the evening, so I'm going to go ahead and get started. I'm Dr. Alexis Gopal from Vitality Medicine of New York City, and I just before we get started, I'm going to give you a little bit of background on myself before we get started. I'm a board-certified internist. I've been doing this almost 30 years. I have 2 brick and mortar practices. I have one in North Yonkers and one in Midtown Manhattan, 42nd Street, near Grand Central. I also have a virtual practice for patients who live out of state. So I do have patients that I see virtually from all over the country. Oh, okay. Wendy, can you hear me? Okay. So how did I get here? After realizing that my chronically ill patients were not getting better, and after my own frustrating experiences as a patient, I decided to embark in training in functional medicine where illness is treated at a root level, at the root, at the root cause, rather than just treating symptoms with medications. And it really, really made a difference in my life. Okay. Okay. I'm going to get started. So that's what led me to functional medicine, and I want to make the difference that it made for me with my health. I want to do that for other people, and that's why I'm embarking on a series of videos and an educational campaign to make people aware of functional medicine and how it can help them. And today's particular topic, gut health, inflammation, and chronic autoimmune illness, hits close to home. Just to give you an example of the difference between functional medicine and traditional medicine, if you came to me as a traditional doctor with asthma, I would probably give you an inhaler, send you home, have you come back for a follow-up appointment to see how you were doing. However, if you came to me as a functional medicine doctor with asthma, my approach would be totally different. I would try to figure out why you have asthma in the first place. Do you have food allergies or sensitivities? Do you have an immune system issue? Are you deficient in some nutrients? Have you been exposed to toxins that are triggering the asthma? By addressing those root causes, the asthma is going to improve or go away, and you may end up not needing the inhaler in the first place. So that's just kind of to give you an example of how functional medicine differs from traditional medicine. Okay, is everybody doing okay? Can everybody hear? I'm going to give it 1 second. Julia, can you let me know if you can hear me okay? Okay. So who is this webinar for? Well, it's not just for folks with autoimmune disease. It's for everyone. You know, it's for folks with migraines. It's for folks with asthma. It's for folks with IBS. It's for folks with obesity, infertility, hormonal issues, fatigue, depression. This is for everyone. And the reason is because inflammation is a root cause for many, many diseases. It's not just for autoimmune disease. You know, inflammation causes everything pretty much. So by addressing inflammation, we're actually going to kind of touch on how to make a lot of things better, not just autoimmune disease. So what are we going to cover this evening? So, you know, tonight we're going to discuss a few things. First, you know, we're going to discuss my Hashimoto's thyroiditis journey, a cautionary tale. I'm going to tell you about my own personal experience with Hashimoto's and how my journey through traditional medicine really frustrated me and has frustrated many of my patients. I'm also going to discuss, what does leaky gut have to do with inflammation? What does one have to do with the other? A lot of people are not aware of that connection. I'm also going to talk about why healing your gut is going to actually help your autoimmune illness and or your asthma, depression, you know, whatever other inflammation-related illness you might have. And lastly, I'm going to talk about what you can, you know, practical things that you can do at home to feel better. And then at the very end, you know, I'm probably going to talk for about maybe 45 minutes. And then at the very end, I'm going to open it up for questions and answers. I'm going to try to stick to that schedule because I know everyone's got things to do this evening. So I'm going to tell you about my journey with Hashimoto's, the cautionary tale. My last year of medical training back in 1994, suddenly I developed really bad exhaustion, really severe muscle cramping. And I looked like I aged about 30 years and I was only 29 years old. So no exaggeration. It was like an overnight, very dramatic change. So I decided to go to my primary care doctor, just like anybody would, and they ran some basic tests and, you know, blood counts, chemistry, thyroid tests, and of course, everything was normal. And my doctor said, "You're fine. You're probably just tired from working so many hours, you know, take a break, but you're just fine." But I knew I wasn't. I knew I had never felt that way before. I'm talking severe. Imagine your whole body having a Charlie horse at the same time. And your features changing dramatically. You don't look like the same person. You know, imagine being so exhausted that you're just falling asleep during the day in the middle of a conversation. I mean, those are pretty dramatic symptoms. It was more than just working a lot of hours. But, you know, my primary care doctor said, "You're okay. Your blood work's fine. You know, go take it easy." So my then fiance and I decided to take a trip to Puerto Rico, and it was a wonderful trip. We had a really great time. On the way back, when we were in JFK, back in New York from vacation, I was in the ladies' room washing my hands, and I just happened to look up in the mirror, and it looked like I swallowed a grapefruit. I had this huge mass in my throat. It was really frightening. It was a goiter. You know, it was an enlarged thyroid, and it was really dramatic. So upon return, I decided to order my own blood work. I didn't go to anybody this time. I ordered my own blood work, and lo and behold, my thyroid tests were crazy. My TSH, my thyroid stimulating hormone, was markedly elevated, and that's a sign of a very slow thyroid. My free T4, my thyroxine, was very, very low. That's what the thyroid actually puts out. But what was really dramatic is that the antibodies, there's 2 antibodies against the thyroid. They were like off the charts. My anti-thyroid antibodies were so high. It was crazy, crazy dramatic. So, I made an appointment with an endocrinologist who said, yep, you have Hashimoto's. And that was basically it. They put me on Synthroid, which is basically T4 or thyroxine, and he sent me on my way. No instructions, kind of just, we'll recheck your labs in a few months. Bye, Felicia. We'll see you in a few months. And that was it. No guidance on anything. So, I went on my merry way. But let me backtrack a second because I want to explain something. And I'm not sure if you could see this graphic because it's kind of small, but TSH is made by your pituitary. It's called thyroid stimulating hormone. So it stimulates your thyroid gland to make T4, okay? T4 is not the active form of thyroid. It has to get converted to T3. It has to lose 1 iodine molecule to make T3. So, when your TSH goes up, it's sending a signal to your thyroid, make more because you're too slow, speed it up. So, when that happens, you definitely have low thyroid. But the thing is, most traditional doctors only check TSH and T4. And if you're not converting T4 to T3, which is the good stuff, which is the active stuff, which is what the, what speeds up your metabolism or slows down your metabolism, is what, makes your body function. They don't check that, and they still don't in 2021. So, I just wanted to backtrack and point that out, because you can have a normal, TSH and T4 and have a low T3 and have all the symptoms of low thyroid. But your doctor will tell you, oh, you're fine. But the reality is you're not. You still are hypothyroid and very symptomatic. But nobody knows it because they haven't checked. Okay. The other thing is, doctors don't monitor antibodies. They'll check the antibodies, to make the diagnosis of Hashimoto's, which is an autoimmune form of low thyroid. There are other, forms of low thyroid. You can get low thyroid without having an autoimmune issue. You can have low thyroid if you have a zinc deficiency or a selenium deficiency. Those are nutritional reasons, or iodine deficiency, and it has nothing to do with having an autoimmune issue. But doctors don't monitor your antibodies routinely, so that makes a huge difference, because your thyroid, you could take thyroid hormone, but if your antibodies aren't monitored and you continue to have high antibodies, the inflammation doesn't go away. So I compare it to like an alcoholic who has an inflamed liver. They continue to drink and the liver continues to be inflamed, and eventually the liver scars over, gets scar tissue and stops working. And that's called cirrhosis. And so what happened with me was, my antibodies were not monitored. Over the years, I just took the thyroid hormone. And over the years, the inflammation continued, and it got to the point where I developed cirrhosis of the thyroid. And so despite the fact that after I became knowledgeable about functional medicine and I was able to get my own antibodies down to 0, unfortunately, it was too late for me. And I am dependent on thyroid hormone for the rest of my life, because, the scarring continued. Okay. So that was my cautionary tale of Hashimoto's, and how I was managed, and what happened despite the fact that I was treated. I was treated through a traditional paradigm, but I still, my thyroid became damaged, and I still kind of felt crummy, even though, with some thyroid hormone, I did feel somewhat better. I never got back to the way I felt when I was, before I was diagnosed. So what does this all have to do? What does all this inflammation have to do with gut? So I'm gonna talk to you about a normal gut and leaky gut, and what that has to do with inflammation and with autoimmune disease. So when I talk about the gut, what I'm really talking about is our small intestine and large intestine. Our digestive system starts in our mouth and ends at the end of our large intestine and our rectum. But when I'm talking about the gut, when I refer to leaky gut, I'm actually talking about small intestine and large intestine. So when you look at the cells of our gut, they're very thin. They're paper thin, really, really thin and very delicate. And I don't know if you could see my cursor, but a normal gut, the cells are nice and pink and healthy. There's a tight seal in between them. Okay. They have little tentacles here. So the food passes here above, when you ingest something, it goes through here, the lumen of your intestine. And this is your blood vessel. So when you absorb, say, your nutrients, they go through the cell and they get absorbed into your bloodstream, and your body uses it. For example, B12 gets absorbed, goes into your bloodstream, and your body uses it. Usually, it's very important for your nervous system and so on. So this is a normal gut, a normal functioning gut that only allows in what's supposed to get in. However, what happens when, you take antibiotics a lot, you've had a lot of ear infections when you were a kid, if you eat a lot of processed foods with a lot of chemicals, what happens then? And I'm going to tell you what happened to me. I'm going to tell you what led to my leaky gut. What led to my leaky gut was, first of all, I grew up in the 70s, and that was the era of junk food, TV dinners and chips and all kinds of processed foods. But I was also a very sickly child. So, I had asthma. I was on tons of antibiotics. I think I was on antibiotics every year. I always had a pneumonia or an asthma or something. So between that and having processed foods, eventually what happened is what happened in this diagram. The cells, the lining of the gut became very inflamed. And you see that tight seal that was there before that kept out all the bad stuff. Well, the seal broke down. You see the seal in between the cells broke down. So things were getting into my bloodstream that didn't belong there. Things that normally would pass out through your feces were getting into my bloodstream. And that is what leaky gut is. And what happens when those toxins get in? What happens when foreign proteins get into your bloodstream? It causes inflammation. It mounts an immune response. So your immune system starts to rev up, saying, uh-oh, there's a foreign substance in the blood. Let's go attack it. But here's the problem. I'm going to talk to you about something called molecular mimicry. And what that means is some of the things that get into your bloodstream. Imagine this. This is a terrible way to think of it, but imagine feces is actually getting into your bloodstream. Things that shouldn't be getting into your bloodstream are getting in. And some of those substances actually look like parts of our bodies. Some of them, that's called molecular mimicry. Molecularly, some of those things look like our body tissues. Like, for example, there are things that can get in that look like your thyroid. There are things that get in that can look like your cartilage. There are things that get in that look like the white matter of your brain or the myelin sheath, the covering of your nerves. So these things get in and trigger an immune response. But here's what's going on. Not only does your body attack those foreign proteins and substances, but it also attacks the part of your body that looks like what's getting in there. And that's called molecular mimicry. So this is what leads to autoimmune disease. So for example, the stuff that's getting into your body, if it looks like your thyroid, well, guess what? Your body's going to attack your thyroid and it's going to cause Hashimoto's. If it looks like your lungs, it's going to attack your lungs, cause asthma. If it looks like your cartilage, it's going to attack your joints and cause rheumatoid arthritis and or lupus. Actually, lupus, it can affect any tissue in your body. If whatever is getting into your system looks like your skin, that's what leads to eczema and psoriasis. So that is the relationship between gut and inflammation. So, in Eastern medicine, they knew it. They knew it 3,000 years ago. They knew that the gut is our center of our health. If you want to be healthy, you have to have a healthy gut. Inflammation affects everything, and I think, this is just an opinion. This is not fact. But I think in the future, research is probably going to show that things like depression and migraines are actually autoimmune diseases. And we know that they're inflammatory, that there's inflammation involved. But I think, this process that's responsible for a lot of autoimmune diseases is probably responsible for more than we realize. So gut health is really, really, really super important. So I just wanted to talk about molecular mimicry. Okay, so if I could hop into a time machine and go back to 1994, how would 2021 Dr. Alexis have treated 1994 Dr. Alexis? So as you could see here, well, I was a brunette back in the day, but as you could see here, look at my face. You could see how puffy my eyes are. You could actually see my goiter. If you look at my neck, it's actually smaller than it had been at the airport. I mean, honestly, it looked like a grapefruit. And here it was starting to shrink a little bit, but you could see in my face. I wasn't joking when I said I look 30 years older, because I am 30 years older now. And I did. I looked 30 years older, but at the time I was really suffering. I was exhausted. I mean, they weren't even Charlie horses. I was in constant pain. And because all I did was take some thyroid medicine, but didn't treat the inflammation, I really didn't get better. My numbers got better, but I never treat numbers. I treat the patient. So how would 2021 Dr. Alexis have treated 1994 Dr. Alexis? Well, couple of things. First of all, I would have asked 1994 Dr. Alexis a lot of questions. That's the one thing about functional medicine. We really get up in your business. We ask a lot of questions. And some of those questions are, were you a vaginal delivery or were you a C-section? And what difference does that make? It makes a big difference. If you are a vaginal delivery, as you pass through your mom's birth canal, you pick up some good bacteria, and that seeds your GI system, and already you're protected. You pick up some immunity. So that makes a huge difference. Were you breastfed or bottle fed? Again, that also makes a huge difference. As we all know, studies have shown that breastfed babies have an immunity advantage because they get the colostrum, they get the immunoglobulins through the breast milk. So that makes a huge difference. We want to know, are you at a disadvantage from the get-go? I would ask 1994 Dr. Alexis, did you eat a lot of sugar as a kid? Did you take a lot of antibiotics as a kid? Were you abused as a child? That makes a huge difference. Studies have shown that abused children, whether it be physical, emotional, or sexual abuse, definitely develop medical issues as an adult. So all those, all that old history from childhood is very relevant as an adult. So I would definitely ask Dr. Alexis from 1994, those questions. I would also ask about family history. Some autoimmune, there is a genetic component to autoimmune disease. It's not all environmental. And interestingly, not one other person in my family, even my extended family, has autoimmune disease. I was the only one. which really convinces me that my Hashimoto's was brought on by a lot of antibiotics and really crummy eating habits. There's not, I mean, I asked about cousins and distant cousins and, cousins twice removed. Nobody had any autoimmune disease. Nobody had any thyroid issues. So his family history is very important. I would also ask any surgeries, especially abdominal surgeries, any kind of abdominal surgery, whether, if you have your gallbladder taken out, your appendix taken out, anything is going to disrupt your gut. It's going to slow down the motility of your gut. And what happens? The bad bacteria starts to grow and that'll throw things off. Those are the kind of things that lead to IBS, irritable bowel. I would have asked Dr. Alexis from 1994, have you had food poisoning? Because food poisoning can also lead to overgrowth of the bad bacteria in the gut. I would have asked about menstrual history. Menstrual history is important because when you don't have good gut health, you don't have good hormonal health. If you don't have good hormonal health, those are the women that have irregular periods, heavy periods, painful periods, endometriosis, fibroids. So a menstrual history is super, super important, when you're trying to figure out what's going on. I would also ask, what else is bothering you? I mean, do you have anything else going on? Any other symptoms? I wish somebody had asked me, because at the time I also had severe debilitating migraines and asthma. I also had a bunch of different food allergies and eczema. I had severe fatigue, more than a resident would have, in medical training. I mean, I know they work, 100 hours a week, but it was just beyond that. I also had, really bad constipation, and I did have really super heavy periods to the point where I was always anemic all the time. Also, I would, if I were treating Dr. Alexis from 1994, I would have checked a T3. I would have checked to see if I was converting T4 to T3, because when I first went to the doctor and I wasn't feeling well and they said, "Oh, you're fine, your blood tests are fine," it would have been good to know what my T3 was, because I bet money that it was low. Even though my TSH and T4 were okay, I bet you my T3 was low. So I definitely would have checked a T3, a free T3 back then. And I would have monitored her antibodies. I wouldn't have just checked it once, made the diagnosis and say, "All right, see you later." I would have followed them, and I would have given her some advice on how to bring those antibodies down so that you could reduce the inflammation so that your thyroid doesn't get scarred up. So I might have actually had a chance to reverse all of it. If I could have reversed that inflammation and ate well and I could have reversed it and probably gotten off of thyroid hormone, and I wouldn't have to be dependent on it today. Unfortunately, that didn't happen, but that's what if I could go back in time, I would definitely have done that. I would have definitely counseled 1994 Dr. Alexis on good eating habits, on, switching to a healthier diet. I would have checked her for food sensitivities. Food allergies are different from food sensitivities. There may have been things that I was eating that I wasn't aware were triggering migraines and triggering a lot of inflammation. Sometimes it's not obvious. So I definitely would have checked her for food sensitivities. But I think the most important thing I would have done is that I would not have made her feel like all her symptoms were in her head. Because unfortunately, especially with women, I mean, and it can happen with anybody, but especially with women, when they go to their doctors, with a lot of complaints like fatigue and malaise and pain and things like that, and the blood work comes back okay, they're invalidated by being told, it's all in your head. And I think out of everything, I would have never made 1994 Dr. Alexis feel that this was all in her head, because it wasn't. Okay, so I just want to make sure I cover everything. I'm just looking at my notes. I'm sorry if they're crinkling and making a lot of noise. Yeah, so that's how I would have treated 1994 Dr. Alexis. Okay, so how do we heal leaky gut? What can you do at home for leaky gut? Well, first of all, try, if you can, try to avoid antibiotics. Antibiotics are a wonderful development in modern civilization, but they're overused. People come in all the time with just viral infections and colds and things like that and want to be put on a Z-Pack. I would avoid antibiotics if at all possible. I would avoid processed foods. The standard American diet is killing us. Unfortunately, a lot of people are making a lot of money from processed foods. A lot of these food companies are making a lot of money, but processed foods are killing us. Processed foods are one of the reasons that there's such a high rate of obesity and diabetes and heart disease. So I would try to avoid processed foods. Like I said, I grew up in the 70s. You know how the 70s were, TV dinners and chips and Pepsi and, all those things were full of chemicals that just destroyed my gut. So avoiding processed foods is really important to your recovery. Avoid foods that you're allergic to or sensitive to. And sometimes that's not easy to figure out because a food allergy or food sensitivity is not always obvious. It's not always like hives and your throat closing up or your eyes swelling up. It's not always that obvious. Sometimes it could be just something as simple as feeling tired after eating something or feeling achy, getting joint pains after eating something. And a lot of people don't make that connection. If possible, if you could get tested, that would be great. The other way to do it is to do an elimination diet, which is where every week you take something out of your diet, things that commonly trigger reactions, things like refined sugar and dairy and gluten, nightshade vegetables, eggs, those types of foods that are very immunogenic, which means, they trigger your immune system. And then after they've been out of your system for a while, you start to add them back in one at a time, so if you've taken out eggs for a month and you're going to add it back in, you eat eggs for about, 3 or 4 days and see what kind of response you have. So an elimination diet might help you figure that out if you're not able to get to a doctor to be tested. Take a good pre/probiotic. What the heck does that mean? Okay, I'm going to tell you. So, everybody knows probiotics are the good bacteria, and everybody takes probiotics. And, the point is to repopulate your gut with the good bacteria. But taking a probiotic by itself is useless because you got to feed those good bacteria. They need something to eat. They're not going to just, live on love and free air. So they need food. And what is food for probiotics but prebiotics? So you can find prebiotics tend to be very fibrous, starchy foods. And you can find them as supplements. And you can find them in some shakes and things like that. They commonly have inulin. And probiotics, love to feed on that. So, and there are some supplements that have both combined. And the other thing that will help heal your leaky gut is if you have any kind of nutritional imbalance, if you have low zinc, B12, low D especially, try to supplement those imbalances. What's unfortunate is that most traditional doctors don't routinely check for those things, and most insurances don't pay for those things to be checked. So if you happen to know that you're low on B12, stay on top of it. And by the way, just an FYI, traditional doctors' idea of low B12 is very different than a functional medicine doctor's idea of low B12. If you fall within the normal range for B12, even if it's like on the lower end, your regular doctor is going to say you're fine, which is not true, because you could be on the lower end and be exhausted and have all kinds, you could have like numbness and all kinds of symptoms from a low B12 and still be in the normal range. So, for functional medicine doctor, our normal is actually above the higher end of the normal range. So for example, a traditional doctor would be satisfied with a B12 level of 300. I'd be mortified. I'd be like, what? You're B12 deficient. we want it around 1,000. So, there's a lot of little differences like that between traditional and functional medicine. Now, specific to autoimmune disease and gut health, there's a few things I want to mention. First of all, it's really important that your vitamin D3 and zinc levels are normal. And the reason is because they modulate immune function. So they're very, very important for the immune system. So many people are D deficient. I would say like maybe 85% of my patients just in general, even in my old internal medicine practice, would be deficient. So it's really important to stay on top of that. A good doctor who treats autoimmune disease will make sure that a patient's vitamin D levels are in a good range. It's so important for the immune system, with zinc as well. Avoid caffeine, alcohol, refined sugar, grains, dairy, red meat, gluten. All those things are very inflammatory. So I know, it's very restrictive, but, as long as you've got a lot of inflammation in your body going on, I would avoid those foods. Focus on eating fresh, organic fruits and vegetables, healthy fats, and wild-caught fish. And I put the focus on organic because unfortunately, inorganic foods have toxins. They have things like arsenic, mercury, cadmium, lead, and all of those things. Having a high toxic load like that is also going to cause inflammation and damage your immune system. It's going to interfere with your hormones. It's just going to wreak havoc with the body. And so avoid any kind of inorganic chicken, farmed fish. Farmed fish is awful. Farmed fish is really high in mercury and arsenic. I didn't know this. So listen, brown rice has arsenic. You think brown rice is healthy, but brown rice has arsenic. What else? Try to avoid aluminum-based deodorants or aluminum-based anything, because aluminum also is quite toxic. And you can find it in deodorants. You can find it in baking soda, baking powder, obviously aluminum foil, pots and pans, especially when they start to wear down. So try to avoid toxins because it's going to cause inflammation. It's going to interfere with your body processes. And that's for anything. That's not just for autoimmune disease, but for any disease. And then one of the last things that's really important, and I think one of the most important things to do, is to work on stress management. I can't even tell you the importance of that. And I can't even tell you, I see so many patients every day, and I look at their cortisol levels and I look at their pregnenolone. So pregnenolone is a stress hormone. So pregnenolone is really important for your brain health. And when you're always stressed out and you're always making cortisol, okay, your pregnenolone drops. They have an inverse relationship. So when you have low pregnenolone, you get brain fog. You can't focus. You have to read the same sentence like 10 times before it sinks in, or, you walk into a room and you're like, why did I walk in here again? You just don't have the focus. And that's all stress related. Stress is really a killer. And stress leads to inflammation. So one of the things, I harp on it with my patients and get on their last nerve, but you have to find something that makes you happy, that brings you joy, and do it every day, whatever it is. For some people, it's, exercising. For some people, it's meditating. For some people, it's binging on Netflix. Everybody's different. Everybody's unique. But whatever it is for you, you need to find whatever it is to keep your cortisol levels down, because that really, it's not just, stress. Stress. It's really stress does kill. And I see it all the time, and it's really, really something that we can do something about. Let's see. I want to make sure I covered everything, and then we're going to go to questions and answer. How are we doing for time? How are we doing for time, Julia? Oh, good. We're right on time. Okay. Well, Bentley says it's time to turn in. Thank you. And thank you so much for sitting through my presentation. I very much appreciate it. It's really a labor of love for me. After my own experiences, my own health experiences, I really want to get the word out there because there's so many people who have just lost hope and are just so demoralized and think that there's nothing available to them and that's it. But that's not true. And I really want to get the word out. So I really, really appreciate that you sat through my presentation and listened to my crinkly papers and stuff like that. And right now I'm going to open it up for some Q&A. Before I do that, I just want to mention if anybody has any questions or is interested in working with me, there's a couple of emails. Emails that I have here. If you're in the greater New York area, if you're in New York, you can email info@vitalitymedny.com, and that's where I have my offices. I have one in Manhattan and one in North Yonkers. If you're out of New York State and you'd like to either speak with me or work with me, you can email me at support@alexisgopalmd.com. So I just wanted to mention that before we go to Q&A. So I'm going to take a few questions because I do want to stick to our schedule. We have a few minutes for some questions. So let's go through some questions. Okay, let's see. How do you reduce, okay, Patty, how do you reduce the thyroid antibodies? Okay, you have Hashimoto's, okay, celiac, okay, all right. Okay, how do you reduce the antibodies? Okay, so that's a great question. How do you get your antibodies down? Well, the first step is healing your gut. So all those things I mentioned, all those things on the slides, like, finding out what you're allergic to and taking them out of your diet, removing inflammatory foods, even foods that you're not allergic to, but are not sensitive to, things like alcohol and red meat and those things, like I mentioned in those earlier slides, get them out of your diet. Make sure that you are, correct your D3 and your zinc and all the things that modulate your immune system. I can tell you for myself personally, I actually right now, I just checked my anti-thyroid antibodies, and I used to have a positive ANA, anti-nuclear antibody, which is positive in many autoimmune diseases, and they're both down to 0. And how did I do it? I'm like, I don't eat any processed foods, and it's all organic, all whole foods. I stay away from dairy as much as I can. I don't eat gluten at all. I don't eat pasta. I don't eat bread. I just don't do gluten at all. I don't have celiac. I just, just because of the reason that I have autoimmune disease, I stay away from gluten and dairy just off the bat. So, stress management, a combination of all of those things, just reducing inflammation. I was able to get my antibodies down to 0. I wish I had done it 30 years ago though, because unfortunately I don't have thyroid function, but yeah, I just checked it probably like 2 weeks ago. And my antibodies are down to 0. So that's a great question. And that's how I would go about it. Let's see. Let's see if there's another question. Okay. Does anybody else have any other questions? Does anybody else want to type in any questions? Take advantage. You've got me for another 10 minutes. So, please feel free to ask me any questions. Would I recommend drinking kombucha? Okay, that's a great question. Kombucha is great. Fermented foods in general, they're a great source of probiotics. but and it's great. If you eat kombucha and it sits well with you, that's great. But a lot of people don't react well to fermented foods. It actually triggers their migraines and things like that. And kombucha, you're right. Kombucha does have some amount of a bit of alcohol and a little bit of sugar. So I don't, it really depends. Some people, it just doesn't agree with them. And so I have a lot of patients where kombucha and fermented foods trigger their migraines. So it really depends. I prefer to get my probiotics. Obviously I can't get it from dairy. I take a supplement. Do I consider fibromyalgia to be an autoimmune disorder? The answer is possibly. I'm gonna tell you why. I've had many, fibromyalgia, which is a horrible, horrible illness. Everybody who has fibromyalgia, they're tired, they're depressed, and they're achy. They just hurt everywhere. But I've had many patients with fibromyalgia come to me with leaky gut and with really low vitamin D. And when I've corrected the vitamin D, like probably 90% of the symptoms have gone away. So I don't know if it's really fibromyalgia or if it's something else. The theory now is that it is an autoimmune disease, but you know what? There's a lot of research coming out now that possibly polycystic ovaries is an autoimmune disease. So, the jury's out. But you know what? I treat everybody the same, whether you have fibromyalgia or if you have multiple sclerosis or if you have, Hashimoto's or whatever the case is, any autoimmune disease, I treat everybody the same. I start by fixing their gut because, 80% of your immune system's in your gut. If your gut's not right, your immune system's not right. They go hand in hand. So no matter what you have, I always start by healing the gut. That's it's like right off the bat. And then, and alongside of it, I correct nutrients. I have, I work on the diet. I have a wonderful coach that works with me. We work on the diet. I always test for allergies. I have a very systematic way of addressing just about everything, but it always starts with healing the gut. Yes, psoriatic arthritis is an autoimmune disease for sure. Yes. Psoriasis is an autoimmune disease. The arthritis is a complication of it. So most definitely, psoriatic arthritis is definitely an autoimmune disease. Would I recommend any supplements for leaky gut? Well, first of all, it's impossible to have good gut health with low vitamin D. So, I harp on vitamin D because it's important for gut health and for the immune system. A good pre and probiotic, and eating well, and managing your stress. As far as specific supplements, other than that, unless you're low on zinc or we know that you're low on B12, whatever you're deficient in, that should also always be corrected. Berberine is an herb. It's an herb and it helps to balance out the bacteria in your gut. It's very useful in treating small intestine bacterial overgrowth, which is a condition that leads to IBS. So berberine is a good one for gut repair. But other than that, nothing specific. I do have a gut repair protocol that I put people through, but nothing specific. Let's see. I want to just keep an eye on the time because I don't want to go over. Okay. Okay, Irene. So you tried an autoimmune diet and you were very successful with it, except that you still had leaky gut issues. I need more specifics, Irene, if you want to email me, because, specifically like what the issues were, like what the symptoms were. So that's kind of hard to answer. Diet is only part of it. So let's see. Ulcerative colitis. Yeah. I have a lot of patients with Crohn's and ulcerative colitis. And again, which are autoimmune diseases. And again, I take the same approach. I take this, I take the same approach. I'm very systematic and very holistic. I don't just treat the gut and ignore everything else. I treat the gut, I detox, I correct nutrients, I work on lifestyle, I work on hormones. So it's a very holistic approach, because if you just treat one thing, if you just get focused on one thing, it doesn't fix the problem. So you have to kind of look at the person as a whole and address everything at the same time. It's not just, diet, and it's not just, it's everything. You got to look at everything. So with ulcerative colitis and Crohn's disease, like I said, the first thing I do is I start a gut repair protocol. I put the patient on an elimination diet. I do check for food allergies. Unfortunately, in New York, and I don't know why, I still don't know why, they don't allow us to test for food sensitivities. Which is, food allergies are mediated by IgE, immunoglobulin E, and those tend to be more faster reactions. So if you have a nut allergy, you eat a nut, you get the swelling right away. Whereas food sensitivities are mediated by immunoglobulin G, and it's a slower reaction. So you could eat something on a Monday and not get a migraine until Thursday, and you don't make that connection, and you don't realize that you're sensitive to that particular food. So as far as with inflammatory bowel disease, it's really important to track down, what foods you might be sensitive to and allergic to. But again, my approach is the same as to somebody who has Hashimoto's, as to somebody who has multiple sclerosis. Heal that gut, detox the patient, fix the hormones, fix the nutrients, get some stress management on board. It's a holistic approach. What is C-reactive protein? Okay, C-reactive protein is an inflammatory marker. It tells us, if it's elevated, it tells us that you have inflammation in the body. It's not specific for where it is. I wish it could tell us, okay, your inflammation is here, in that swollen knee that you have, but it's not. It can be elevated for many reasons. It could be elevated because of just inflammation. It could be elevated because of infections. It could be elevated because of cancer. And it could be elevated because of stress. It could be elevated because of insulin resistance. So there's a few, not just inflammation can make your C-reactive protein go up. So, a C-reactive protein in isolation is not very helpful. It is helpful when you look at it with all the other test results. Let's see, I'll take a couple more questions. Okay, for a supplement of vitamin D with 20,000 international units be too high? That's a high dose. However, it all depends on your levels. Some people have a hard time at absorbing vitamin D. So for somebody who has that issue, that might be an appropriate dose, but I don't dose and then not recheck it. I tend to use 5,000 international units a day, but I monitor it because you can get vitamin D toxicity. If you have a vitamin D level 100 or above, you can start to get toxicity. So that's not something you want to take lightly. So it all depends. I know a lot of neurologists that use high dose vitamin D for their patients with multiple sclerosis. But it's a very individual thing, and vitamin D levels have to be monitored carefully. Okay, I'm gonna take one or two more questions, and then I'm gonna bid you all good night. Okay, great question. Irritable bowel. Okay, how is that managed? Okay, we look for the root cause. Okay, so a couple of things that lead to irritable bowel: food poisoning. People think, I had food poisoning when I was 17 and, I got over it. I was fine. But you know what? That's not the truth, because food poisoning is associated with irritable bowel, because it messes up the bacteria in your gut. It makes some of the bad bacteria overgrow and the good bacteria dwindle. That's one thing. Another thing that leads to irritable bowel is something called small intestine bacterial overgrowth, SIBO. SIBO is one. As a matter of fact, I used to have irritable bowel, along with all those other things. So the way to treat IBS, instead of using, like if you're constipated, I know, a lot of GI doctors like to use Linzess, to treat constipation. There are other medications if you have IBS with diarrhea. The way I treat IBS is that I try to figure out what caused it in the first place, if it was food poisoning or if it was SIBO, and treat it. So again, just like anything else, if you come to me with anything, I'm gonna repair your gut first. So anybody with IBS, I put them through a gut repair protocol, and if they have SIBO, I test them for SIBO, and usually people with SIBO complain of bloating. That's like their huge complaint. I'm so bloated. I'm so bloated that if I drink a glass of water, it makes me bloated. I can't eat because I'm so bloated. It's crucial to treat SIBO if you want to get rid of the IBS. So I have many, many patients with IBS and who have SIBO, and it's there. You could do it with. You can do it with supplements, you could do it with like natural things, and you can do it with prescription antibiotics, and depending on the severity of it. But yeah, I have a lot of patients with IBS, both kinds, constipation and diarrhea, or both. But the way to treat it, like with everything else in functional medicine, is to find out what caused it in the first place. And I have time for one more question. Okay. Sarah, okay, great question. So your rheumatoid arthritis is very painful, and you don't want to take opiates. I don't blame you. Opiates are really bad, and not just because of the addictive potential, but opiates, studies have actually shown that it can potentiate pain and actually make you more sensitive, so that ultimately you'll be in more pain if you stay on them. So the way to reduce the pain without having to rely on all these over-the-counter pain medications is to reduce inflammation. So rheumatoid arthritis is inflammation. It's inflammation. So, all the suggestions that I had for reducing inflammation, all those, food-related things, healing your gut. Fish oil is great. I love fish oil because fish oil is a natural anti-inflammatory. It has to be at a certain dose though, but I put my mom on fish oil for her arthritis. She has terrible arthritis. But again, I know it sounds repetitive, but again, reduce that inflammation. So how do we do that? Fix the gut, fix the gut, don't, eat organic, don't eat toxins, heal from within. I tell you, the body's amazing. The human body is an amazing creation. God knew what he was doing. If you give it love, if you feed it well, if you move it, it's going to heal itself. And so if you have a lot of inflammation, reducing the inflammation is going to, reduce the pain. Is fibroids a gut issue? Kind of inadvertently. Fibroids is a hormonal issue. Fibroids is the result of having too little progesterone. And why do you have too little progesterone? It's usually a gut issue. So kind of in an indirect way, fibroids is, I think everything's a gut issue, but in an indirect way, yes, fibroids is a gut issue because it affects your hormone levels. And when you have too little progesterone, that can lead to fibroids. So I'm going to stop here, and thank you so much. Oh, I appreciate you guys showing up and spending your time with me. I know you guys are all very busy. Much appreciated. And please feel free to reach out to me. Feel free to reach out to Julia. Julia, thank you for moderating. I appreciate it. And I will be doing, check out my, I'm not big on social media because I always have to ask my kids, how do you do the Instagram again? But I'm trying to really put out videos and information and graphics and things like that. So I have a YouTube, I have an Instagram, I have a Facebook, I have a Pinterest. So look at any of, if you look at any of those, I try to post as much information as I can, because I really want to empower people to take charge of their health. There's a lot out there that you're just not aware of. And I'm trying to empower people to take their health in their hands. My message to all my patients is, please don't lose hope. Don't lose hope, because everything's reversible. Almost everything is reversible. So don't lose hope. I'm trying to put out information. So take a look at my social media. I'm going to try to post as much as I can, but I really enjoy talking to all of you. Thank you so much for spending your evening with me. And I hope to speak to some of you individually, and maybe even meet you in person. So thank you so much, and much love and much health. And everybody please have a wonderful, happy, healthy 2021. Thank you.